Going to learn about it in just a moment. Let me say one quick thing about this topic. How to pay for Medicare for all? Are you kidding? How do you pay for a system that is twice the cost, almost 19% of GDP, bankrupting businesses, putting a huge hole in government spending, of course, bankrupting households? We have the most overpriced, inequitable, and inefficient system in the world. We're wasting hundreds of billions of dollars. We spend far more than any other high-income country and get less for it. So the issue cannot be how do you pay for something that is cheaper, more efficient, and more fair.
And I have to fix it in like 19 times after it, and they said, well, maybe. So that's how it got to be decent, but it still wasn't really that good. And then we showed it to the reviewers, including Jeff Sachs, who were also pains in the ass. And they all had like 7 pages of things that had to be fixed. Jeff had about 18 pages of things that needed to be fixed. And so we fixed them. And that took a year and a half.
An objective, unbiased, comprehensive, and thorough economic analysis of Medicare for All. Professor Poland and his co-authors have set a new high standard for transparency and clarity in presenting their analyses, estimations, and conclusions. The research methods they used to estimate both the cost increases and the savings are sound. The assumptions they used to generate cost estimations are based on the latest empirical evidence. Consequently, William Schau says, the conclusions of the study on the overall cost and savings of Medicare for All are reasonable and scientifically sound. That sounds good. Remarking on this approach and methodology and the significance of the study, another reviewer, Alison Galvani of the Yale School of Public Health, said, this stellar economic analysis of a single-payer universal healthcare system for the U.S. is the first to sufficiently document each step of the calculations, enabling reproducibility of the findings. It's also the first study that thoroughly addresses the transition to and financing of a universal healthcare system for the U.S. Underlying the analysis is an interdisciplinary evidence base that has been compiled from literature spanning economics, health policy, and clinical care both within the U.S. and internationally. The methodology is sound and the assumptions are conservative with regard to their conclusions. Specifically, lower-end figures from the expert literature are used in the calculation of savings, whereas anticipated expenditures are based on the higher end of empirical distributions. So she says, despite stacking the deck against Medicare for All, this analysis convincingly demonstrates the substantial improvements in cost efficiency that could be achieved by Medicare for All. Overall, Medicare for All is expected to reduce national health expenditures. And specifically, your study shows that, and that was Galvani's review, I would add, specifically, your study shows that Senator Sanders' Medicare for All Act can provide universal coverage of every resident in the United States as the system as a whole absorbs a 12% increase in demand for health services. More people getting coverage are going to use more care. But it still realizes a 19.2% in potential cost savings overall. That and the cost of prescription drugs under your approach would be lowered by 40%. Everyone is covered with comprehensive benefits. All commercial insurance premiums, copays, and deductibles are eliminated. That's no cost sharing. And overall, we save 9.6% in costs over the present system.
Less days lost, and less anxiety, less bankruptcies. The biggest winners in this system are the middle-class households, especially if people are paying either out of pocket or through an individual health insurance program. Now, we have them saving 14% of income. In other words, their income goes up effectively by 14% through the establishment of Medicare for All. Whatever businesses are paying in premiums today, the day after Medicare for All comes in, they all pay 8% less. How are they getting more than 8%? So I had to reread it, and the reason is because we estimated their administrative costs, and they're saving on administrative costs. So on top, those administrative costs are meaningful. It's wasteful, but they have to do it, and they're done. 30% of us are what we call underinsured. So what does it mean to be underinsured? Well, you have health insurance, but it is not adequate, so that people don't want to go into, these are like the stories we heard in the last session. They don't want to go in because it costs too much. That's basically it. So they don't go in, and then their health conditions are exacerbated. And so then they wait till they need surgery, and you have to spend $25,000 in surgery as opposed to spending, $80 for a visit. So that is a big source of savings. And we didn't cost that out, fill out forms. And for physicians, we said they're going to save 4 hours a week. And those 4 hours can go to treatment, which, by the way, means that the people get better care, and you get to see your provider. It also means that they can make more money. These are billable hours. All of the major insurers' pension funds are currently solvent, so they have to stay solvent. They get 100% wage insurance for a year, which is over double what we normally give in unemployment insurance in the country. Plus they get retraining support, plus they get relocation support. So those are absolutely critical features. And to the credit of the authors of the bill in the Senate, Senator Sanders and the people that work with him, they do include that. They include the just transition as a feature. Now, they don't cost it out. We costed it out. And it turns out, when we costed it out, our number was basically the same as what's in the bill. Maybe they did cost it out. It so happens I have also done research around the Green New Deal and the job part of the Green New Deal. I've also done research on the military spending and jobs. Once you get rolling with these boring statistical models, it gets fun, and you just keep going. The transition to a green economy is going to create about 4 million jobs. You spend $1 million in the military, you'll create 11 jobs. If you spend $1 million in education, you'll create 23 jobs on average. Yeah. So yes, if we shift out of military spending into other activities, you can create more jobs. If we take the average, if we shift out of the military and then just spend it all on everything in general, you're going to go from 11 jobs to about 14 jobs.